What you people are doing to me? We are just examining your eyesight, but I didn't ask for it.
Hello, this is KHURRAM Nasir and you're watching Optometry with KHURRAM, and today's topic of discussion is the 5 major mistakes or 5 common mistakes or blunders while we deal with the subjective refraction or the objective refraction. And the very first one is we ignore the proper case history of the patient. That why patient visits your clinic, we do not ask about this, right? For example, a patient visits your clinic and you directly start doing the retinoscopy or the auto-ref refraction or the subjective or the objective refraction without asking any chief complaint, without asking any case history about the patient.
What you people are doing to me? We are just examining your eyesight, but I didn't ask for it.
So first of all, when the patient will visits your clinic, do not start the procedure directly. Please ask about the biography of the patient, like the name of the patient, the area of the patient, the age of the patient, the gender of the patient, right? And very important and very necessary is the chief complaints of the patient, that why patient visits your clinic. So case history is very important. Please ask about the case history, like the chief complaints, as I said, the previous glasses history, the previous surgical history, right? The previous ocular health, the previous systemic health, right? So these are very important. These things will help you to make a good diagnosis, and the good diagnosis will lead you to the good treatment and management. For example, in a patient with diabetic retinopathy or diabetes mellitus, you know very well when the value of the diabetes will get higher, it will fluctuate the vision, right? For example, patient visits your clinic and you did not ask about the history of the patient, for example, about the diabetic retinopathy or diabetes mellitus, and the value of the diabetes is higher than the normal, the value of the vision will be fluctuate. The value of the vision will fluctuate, and you will make glasses, you will make prescription of the patient in this higher value of the diabetes mellitus, right? And after that, if the value of the diabetes mellitus will get lower, will get normal, you know, the prescription will get changed, right? So you must ask about the chief complaints and the proper ocular history and the glasses history or the surgical history before doing any tests regarding the refraction. Either it is subjective refraction or it is the objective refraction. The second mistake is we often ignore the accommodation, the accommodative status of the patient. What is accommodation? Accommodation is actually the increase in the plus power of the crystalline lens of the eye, right? So plus power is increased. So by reducing this plus power, you will increase the minus power with the trial lenses, right? And you will increase the minus power, right? And if you increase the minus power, you are over minusing the patient, it will cause a myopia progression to the patient. For example, a patient visits your clinic and he start doing accommodation, and you increase the minus power. For example, if you overcorrect the patient up to -1, it will cause a myopia progression to the patients for the whole life. So it is very necessary to relax the accommodation of the patient, importantly in the younger patients, right? Less than the age of the 15 years. Right? And the solution of this case is you have 2 different methods. For example, if the patient is so young, he is a kid, you must do the cycloplegic refraction to avoid the imbalance of the accommodation. And if the patient is adult, you must perform the fogging lenses or the binocular balancing at the end of the refraction. And the third mistake is we do not check astigmatism properly. For example, you have to be very careful while you are dealing with the astigmatism, right? Because astigmatism got 2 things, 2 principal meridians, right? One is the power and other one is the axis, right? You have to correct both of the meridians. You have to give a precise and accurate power in astigmatism, the cylindrical power, and you must have to prescribe proper axis. For example, if you make a mistake of 5 degree in axis, the vision will be blurred, and if the object is straight ahead, in mistake of the axis of 5 degree, it will look like this, the tilted one. So you have to be very careful while you are dealing with the astigmatism, especially and particularly in axis refinement. So you must perform Jackson cross cylinder properly. And the fourth mistake is the poor communication with your patients. Please do not use tough ambiguous and difficult words to your patients, right? Please use easy words, easy phrases, right, which are very easy to understand to the patients, right? You know very well that there are two different types of the lenses, the spherical lenses and the cylindrical lenses, right? The spherical lenses are concerned with the blurring and clearing of the alphabets or the optotypes, right? If I start increasing the spherical lenses, it will make the letters or the optotypes clearer, darker and sharper, right? I'm talking about the spherical lenses. And if I'm doing refraction, subjective refraction with the cylindrical lenses in astigmatism, you know very well that the cylindrical lens cause it will make these object tilted or straight, right? If I'm prescribing the proper and accurate astigmatic power, the cylindrical power, it will make this tilted object like this, a straight one, right? So the spherical lenses will make the optotypes clearer, darker and sharper, right? And the cylindrical lenses will make the object straight ahead, not tilted. So if you will use the inconsistent or difficult or tough language to your patient, he will answer you in inconsistent way, right? And you will end up with the wrong prescription. And the last mistake is not refining the final prescription. We do not perform the binocular balancing at the end of the subjective refraction. For example, I make this eye 6 by 6, I make this eye 6 by 6, right? But I did not perform the binocular balancing method or tests at the end of the subjective refraction, so it can cause a mistake, it can cause a blunder, right? So it is very important to perform the binocular balancing to balance the accommodation in the both eyes. This is very important, right? If your patient is 6 by 6, if your patient is comfortable with your prescribed prescription in your clinic, it doesn't mean that that patient will be comfortable in the real life with the prescription you prescribed. So the binocular balancing at the end of the subjective refraction is very important to balance the accommodation in the both eyes.